Welcome to Boston Community Health. I'm Dr. Elias Bourne. If you have passed the age 40 milestone, you likely have moments where you suddenly misplace your car keys or momentarily forget a familiar neighbor's name, and you reassure yourself it is just stress or a normal part of getting older. But what if those tiny, forgetful lapses are not actually aging at all, but rather your brain quietly sending out a distress signal because of a silent stroke? Today, we reveal the subtle signs that everyone over 40 strictly needs to recognize now. The greatest tragedy for individuals in their 40s and 50s is that they are far too skilled at finding excuses to rationalize neurological anomalies. They blame professional overload, family stress, or simple lack of sleep for their issues. As you navigate middle age, your vascular system no longer possesses the perfect elasticity of your youth. Microscopic atherosclerotic plaques begin accumulating silently, progressively narrowing the tiny capillaries located deep within your brain tissue. A silent stroke does not trigger immediate paralysis or facial drooping. Instead, it quietly destroys several thousand neurons in regions not controlling primary motor functions. This creates tiny holes within your cognitive network, resulting in those subtle symptoms we frequently dismiss as simple age-related absent-mindedness, while the underlying damage is actually quite severe and cumulative. Observe the very first subtle sign of the sudden disappearance of a common word mid-sentence. You're presenting at work or talking with family, and suddenly, an incredibly simple word vanishes completely. You know the definition, but your brain fails to retrieve the term for several seconds. At age 40, you call this mental overload, but clinically, this might indicate that blood flow to Broca's language area was temporarily interrupted by a microscopic clot, leaving a tiny, permanent scar on your cerebral cortex that remains long after the moment passes. The second subtle sign is a split-second feeling of unsteadiness when you turn or stand up. You assume it is low blood pressure or simple dizziness from sitting too long. Please click like, subscribe to Boston Community Health, and comment your age below. In reality, this sudden instability might result from a tiny injury within the cerebellum, the region managing motor coordination. These silent strokes accumulate over time, eroding your brain's processing power. Without early screening, they become the direct foundation for future chronic dementia or devastating Alzheimer's disease. Warning sign number 3 is frequently confused with a midlife crisis. It is a sudden change in personality or mood. You might unexpectedly become irritable, apathetic, or struggle to regulate your emotions. When silent strokes strike the frontal lobe, the executive center for behavior and personality, they fracture the neural fibers, controlling inhibition, causing profound and unexplained psychological shifts in your daily life. Warning sign number 4 is incredibly subtle. You begin struggling with numbers or simple calculations that you previously handled with ease. Calculating change at the supermarket or managing monthly bills suddenly feels heavy and prone to error. At age 45, you blame it on not using math lately or being exhausted. Clinical reality shows that the parietal lobe, which processes mathematical and logical data, is often a victim of tiny microvascular injuries. This represents a serious red flag that your cerebral circulation is becoming increasingly unstable and stressed. Have you ever suddenly felt more clumsy? Buttoning a shirt, threading a needle, or gripping small objects unexpectedly feels difficult and strangely awkward. You might assume it is a sign of arthritis or just tired hands. But if this phenomenon appears significantly more on one side of your body, it might be the aftermath of a silent stroke within the brain's white matter. This region is responsible for transmitting fine motor signals. When these neural highways become obstructed, your physical dexterity is stripped away little by little without you ever realizing the cause. Warning sign number 6 involves your vision, a brief blur or a sudden darkening. For a few seconds, that clears on its own. Most middle-aged adults assume they simply need new reading glasses or have spent too much time staring at computer screens. But this might be amaurosis fugax occurring when a tiny clot from the carotid artery in your neck travels up and momentarily blocks the retinal artery. Since your retina is a direct extension of your brain, this sign proves your major cerebral vessels are in danger. Do not ignore it before permanent darkness hits. The final sign is your gait becoming shorter or more unstable in a very discreet manner. If you find this clinical knowledge valuable, please click like and subscribe to Boston Community Health right now. These vascular injuries are usually invisible to the naked eye, but they appear incredibly clear on an MRI scan as tiny white scars known as lacunar infarcts, marking silent brain tissue death. The most terrifying aspect of a silent stroke is its cumulative nature across decades. One tiny scar might not cause a severe consequence yet, but after 10 years, Dozens of such injuries lead directly to vascular dementia. At age 40, your vessel walls begin losing their smooth integrity due to high sodium diets, excessive sugar, and professional stress. Chronic high blood pressure is the most silent killer. It continuously forces small vessels to handle massive overloads until they finally rupture or block, creating permanent tiny dead zones within your precious brain architecture. If you notice any of these minor signs I just mentioned, consider it a clinical grace your body is granting you to correct your path. This is the golden window of prevention. Instead of waiting until a major stroke causing permanent paralysis strikes, managing your blood pressure and hemoglobin A1C right at age 40 can effectively rewrite your brain's destiny. Modern medicine is not just about saving lives on operating tables, but more importantly, ensuring you never end up there by protecting your vital oxygen flow starting right now. To know for certain what is occurring inside your skull, structural imaging is an irreplaceable step. A routine physical might show your blood pressure is currently normal, but only an MRI scan can expose the microscopic vascular injuries that have already occurred in your past. Do not fear discovering the truth. Fear remaining ignorant of the facts until it is far too late to act. Identifying these lacunar infarcts really allows physicians to implement antiplatelet strategies and vascular protection, effectively halting the cascading collapse of your precious nervous system. The finest method to stop silent strokes in middle age is constructing an endothelial shield through a high-fiber dietary pattern combined with consistent daily physical movement. When you perform a brisk 30-minute walk daily, your arterial endothelium releases nitric oxide, a life-saving gas that naturally dilates vessels and clears away dangerous atherosclerotic plaque buildup. Vital nitric oxide volume released during continuous muscular contraction does not merely decrease systemic perfusion pressure efficiently, it systematically prevents abnormal blood platelet aggregation and bad cholesterol molecules from sticking onto the arterial walls. Past the age 40 milestone, your body automatically decreases the natural production of this protective gas by nearly 50% compared to your youth. Physical inactivity, combined with high sodium nutrition, significantly accelerates the hardening of your cerebral microvasculature. Incorporating gentle home movements acts as the primary mechanical solution to reactivate your internal nitric oxide factory. When atherosclerotic plaque expands, the persistent microvascular obstruction leads directly to chronic cognitive decline. If you find this video helpful for protecting your family, please click like and subscribe to Boston Community Health right now. The cumulative brain injuries sustained from silent strokes during your middle age function as the primary ignition expanding white matter damage, directly accelerating the development of irreversible memory loss. We strictly need to analyze the psychological errors causing individuals past age 40 to inadvertently nurture vascular diseases within their bodies. The primary mistake represents the habit of blaming chronic exhaustion while abusing central nervous stimulants like coffee or energy drinks to mask neurological deficits. When you experience a transient visual blur or perceive a sudden hand clumsiness while typing at your desk, you choose to consume an extra shot of caffeine to power through the workday. This action inadvertently covers your brain's urgent distress signal, erasing your golden window for early screening. Dangerous mistake number 2 involves purchasing and consuming over-the-counter neurosupplements advertised aggressively online without undergoing proper structural imaging diagnostics. Many individuals at age 45 experiencing mild memory lapses or chronic headaches choose to self-prescribe these cognitive enhancers with hopes of restoring mental acuity. But you must comprehend clearly if your underlying root cause represents an unstable atherosclerotic plaque narrowing your carotid artery. These supplements offer zero clinical efficacy and can severely delay the crucial diagnostic tracking of developing emboli. The singular medical approach to confirm vascular degradation is utilizing advanced structural MRI imaging inside authorized clinical facilities. Your complex brain architecture does not require generic vitamins when its primary nutrient delivery routes are actively stalling in the dark. What your cells demand is a targeted strategy managing systemic pressure, controlling lipid profiles, and removing endothelial inflammatory agents. Do not allow medical ignorance or clinic anxiety to transform minor lacunar infarcts into an expanded, irreversible territorial brain tissue necrosis. Alongside monitoring systemic blood pressure, the next foundational laboratory metric you strictly need to manage right after age 40 is your chronic blood glucose status via regular hemoglobin A1C blood tests. Chronic elevated glucose inside your blood vessel system behaves exactly like microscopic shards of glass, continuously scratching, eroding, and destroying the smooth arterial endothelium, heavily accelerating plaque buildup. The vast majority of adults assume they only face vascular risks upon receiving a formal diagnosis of type 2 diabetes. Clinical evidence inside United States stroke centers systematically demonstrates that the destruction of your cerebral microvasculature accelerates aggressively right during the pre-diabetic phase at age 40, when your hemoglobin A1C falls between the 5.7 and 6.4% threshold. Excess sugar continuously triggers chronic systemic inflammation, transforming smooth vessel linings into rough surfaces where cholesterol easily adheres. Implementing an endothelial protective dietary strategy starting today represents an absolute requirement to preserve your vulnerable neural pathways. Firmly eliminate refined carbohydrates, processed sugars, and manufactured sodas from your daily meal planning. Replace those items with high-fiber foods, anti-inflammatory omega-3 fatty acids from fatty fish like salmon or mackerel, natural antioxidants from dark leafy vegetables. Dietary fiber successfully slows down sugar absorption, maintaining your hemoglobin A1C securely below the dangerous threshold. The third foundational risk factor requiring regular clinical investigation after age 40 is hidden paroxysmal atrial fibrillation. This specific cardiac anomaly prevents the heart's upper chambers from contracting synchronously, causing them to quiver chaotically, forcing blood flow to swirl and pool inside the cardiac appendages, generating large blood clots. When these thrombi are ejected from the heart cavities, they travel directly upward into cerebral vessels, instantly blocking a major branch, triggering a devastating embolic stroke with severe physical paralysis. The greatest tragedy is that paroxysmal atrial fibrillation frequently manifests briefly, lasting only a few minutes per day, and self-resolving, causing a standard 10-second office ECG performed at your clinic to miss it completely. Utilizing a continuous 24-hour Holter monitor evaluation right at home records every single heartbeat across a full day and night, successfully identifying those brief, elusive cardiac anomalies for targeted protection. Once atrial fibrillation is identified early during middle age, cardiologists can prescribe targeted anticoagulant medications, which systematically reduce your cardiac-related stroke risk by 60 to 70%. Combining your hemoglobin A1C blood screening, continuous Holter monitoring, and tracking your daily blood pressure logs constructs the most comprehensive clinical framework helping you dominate your vascular health from the root level. You do not need to live under passive anxiety regarding hidden blood clots. Accurate Tri-TH letter 1E9C represents your shield. However, during the execution of your 5 home microvascular exercises designed to stimulate nitric oxide release, individuals past age 40 must strictly obey a core, life-saving safety principle, the talk test for intensity management. Many middle-aged adults driven by a hurried mindset to achieve fast outcomes attempt to exercise at excessive intensities, forcing their heart rate and blood pressure beyond safe thresholds. If during brisk walking or chair squats, you develop heavy panting and fail to voice a short phrase, decrease your speed immediately. Safety principle number 2 involves completely avoiding abrupt bodily postural adjustments during and after your training sessions. When you are seated or lying down performing cervical mobility stretches, your circulation is actively distributing blood flow to peripheral muscle groups. If you suddenly spring upward to a standing position, gravitational force pulls blood volume down into lower body compartments, triggering orthostatic hypotension for a carotid artery already narrowed by plaque. This sudden reduction in perfusion pressure can instantly cause a transient ischemic attack. To successfully transform today's complex neurogeriatric insights into a practical protective weapon for your life, I want to establish a concise clinical communication protocol consisting of 3 strategic questions for your next physical. Question number 1 you strictly need to present to your physician is based on my unique vital metrics and middle-aged lifestyle. What is the exact target blood pressure threshold I should maintain during home measurements? This crucial query forces the clinical conversation toward establishing a clear baseline, completely eliminating vague guesswork during home logging. Hospital neurologists consistently require this real-world longitudinal data to accurately evaluate your vascular trends, rather than relying on a single isolated reading taken under clinic-induced stress inside the examination room. When this metric stays secure below your personalized target threshold, chronic mechanical stress straining vulnerable atherosclerotic plaques within the carotid artery is entirely lifted, securing your vessels. Strategic question number 2 you strictly need to present during your appointment is, am I a suitable candidate to perform a hemoglobin A1C blood test and a duplex carotid ultrasound to evaluate my underlying vascular plaque structures proactively? This forces the medical conversation toward proactive vascular screening at the route level rather than waiting for structural damage to manifest internally. Identifying the early presence of unstable plaque allows physicians to implement timely interventions before the arterial lumen becomes completely occluded. Strategic question number 3 to discuss with your provider is, do I require an overnight 24-hour Holter monitor evaluation at home to completely rule out paroxysmal atrial fibrillation risks? Any good, highly competent physician will completely welcome these 3 strategic questions from you. They will deeply respect your medical intelligence and appreciate your self-advocacy, allowing you to preserve your cognitive mind to live an independent, happy life of healthy longevity across decades. If your physician dismisses these questions or makes you feel difficult, that is important diagnostic information proving that specific doctor is simply not the right fit for your long-term longevity journey. The ultimate goal of geriatric medicine must be protecting your actual quality of life, preserving your personal independent living, your physical energy, and staying away from an unfeeling automated medical checklist. I want to leave you with a profound clinical philosophy. The silent stroke you successfully prevent through your intelligence will never make breaking news headlines. It carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that wise prevention is just an ordinary morning where your brain stays sharp, your steps remain steady, and you continue enjoying warm conversations with family. Mainstream medicine exists entirely to protect that quiet, priceless, ordinary outcome. You now fully recognize the 7 subtle signs frequently overlooked past age 40, a sudden word gap mid-sentence, split-second instability during quick turns, frontal lobe personality shifts, parietal lobe arithmetic difficulties, white matter, hand clumsiness, transient vision blurs, and a shortened gait. These underlying vascular injuries accumulate silently across decades as lacunar infarcts, which if ignored will severely destroy your cerebral cortex architecture and crucial neural pathways over time. Transform today's vital medical insights into a powerful protective shield, managing systemic pressure, stabilizing hemoglobin A1C, screening atrial fibrillation via Holter, combined with high-fiber Mediterranean nutrition and a brisk 30-minute daily walk. Rest entirely within your immediate personal control. Write down these 7 warning signs and 3 strategic questions inside your phone app to serve as your permanent roadmap, successfully protecting your cerebral blood flow and maintaining peak intellectual clarity. Share this educational video link with the people you care about most, a spouse living alongside you, an aging parent, or a sibling over age 40 who needs this vital screening data. Your small act of digital sharing today might become the exact reason someone's vascular system is saved from a devastating future dementia event, perfectly preserving their independent mind. The individuals who are at the highest statistical risk of facing this vascular storm will likely never search for these clinical studies online. I am Dr. Elias Thorne from the trusted medical organization Boston Community Health. Our professional mission is to deliver honest, international geriatric knowledge without fear-mongering to help you dominate your health destiny. Your brain remains a completely priceless and unique asset, deserving your highest level of wise protection daily through clean daily habits. Within next week's educational series, we will deliver advanced clinical investigations targeting strategies to shield the myelin sheath of your neurons, preventing chronic cognitive decline in older adults. This represents a highly critical subject, helping you construct your complete neurological defense network, maintaining your peak intellectual clarity regardless of the passage of chronological time. Always stay sharp, stay highly informed, and master your own destiny to protect your household from afar. Do not delay another single day. Select just one single action item from today's checklist to implement immediately within your life. The compounding effect of a small habit extending from day to day creates a highly powerful anti-aging clinical intervention over time, successfully preserving the non-stick integrity of your cerebral blood vessels. A sharp cognitive mind and physical independence represent your most priceless assets. To thoroughly enjoy your peace and complete happiness alongside family. Remember clearly that naturally clearing your vascular lumen begins directly from your dining table and your moderate microvascular exercise routines performed tonight inside a warm, comfortable living room. Please click like and subscribe to Boston Community Health right now and leave a comment below about the warning sign that surprised you most. Wishing you continuous health, longevity, and see you next time.